I would like to wish the viewers of Madras Bus channel. I am Dr. V. Shankar Kumar. I am an ENT surgeon and a consultant. Suraksha ENT Centre. It's in Dr. Ranga Road, Mylapore. And I am also associated as a consultant at Apollo Spectra Hospital at MRC Nagar, Chennai. Besides this, I go to a few other hospitals as well.
How are the ear, nose and throat connected, doctor, from a layman's point of view?
Well, you want me to know how the ears, nose and throat, how they are connected. It's a very interesting question. They are definitely connected in more than a way. This is the reason why doctors dealing with the ears also have to deal with the nose and the throat. That is why ENT as a subject is grouped into one specialty. And generally the ENT doctors have to be very well versed to treat disorders of all the ears, nose and the throat. Just I will try to elaborate a little further. Okay, so we all know, like for example, I can cite a few examples which will help us to understand why the ears, nose and throat, they are all connected. You all know when you get a cold mookadappa vandanaka, at that time our ears they get blocked. So ide enna kaaranamnaka middle ear, அதாவது eardrum னு சொல்வாங்க, அதுக்கு உள்ள இருக்கிற compartment பேரு middle ear. Middle ear is also connected to the back of the nose by way of a small passage, as you can see here very clearly in this diagram. This is the middle ear and this is the eardrum. The middle ear is also connected to the back of the nose by means of a small passage. So idoda importance ennanaka, sometimes if the passage gets blocked, which can happen after a simple attack of cold or allergy, the hearing it may get muffled. And all of you would have some point of time, you would have also experienced when you try to fly, go in an aircraft, what happens? You are not able to equalize the pressure inside the ear, and adanala the ears tend to get blocked. The reason is that this passage between the ears and the nose, they get blocked. Idu mattum illa, one more important thing which can happen is that a person having a very bad cold, severe cold, the infection may track upwards again through this passage into the middle ear and may result in a middle ear infection, and this middle ear infection is called otitis media. So adanala in more than one way the ears, the nose and the throat are connected. So now I have told you how the nose is connected to the ear, basically the middle ear. Similarly, we must also know that the nose is also connected to the throat. In fact, nose and throat rendume paatanaka, it forms rendume part of the upper respiratory tract. That's why we know when we may have a cold, often we get the mucus dripping into the throat. Okay, this is one thing. Likewise, in order to produce a good voice, the nasal cavities must be healthy. I think very often you would have find some person, if he has a cold, so these are just a few examples to say that the ears, nose and the throat are all intricately connected, and this is why the field of ENT or ear, nose and throat has come into a single specialty.
இப்போ இந்த இயர் நோஸ் த்ரோட் பத்தி சொல்லும்போது நீங்க சொல்றது வச்சு பார்த்தா பிரெயினுக்கு கனெக்ட் ஆகிருக்குன்னு மாதிரி புரியுது. How is it connected?
Yes. See, one thing we must understand, என்னன்னாக்க hearing, vision, smell, taste, இந்த எல்லாமே sense organ they carry only sensory information. Ultimately, the process of vision or hearing or smell has to be integrated and processed only in the brain. So without the entire setup, we will not be able to hear or we will not be able to see or even smell for that matter. So idhula let me explain to you very briefly. So you want me to explain to you what is the connection between the ear and the brain. So the ear is required basically, okay, to transmit the information, the signal, okay, the whatever we hear. That is the function of the external ear. What you see here, the external ear, it includes the outermost visible portion of the ear, which we call as a pinna, and the auditory canal. Actually, if you see the mechanics of hearing, it's very interesting. The external ear, it is shaped like a cup or like a funnel. It is able to filter or trap all the sound, and in the sound that we hear, sound like any other form of energy, it's a form of energy. So the sound energy is transmitted through the auditory canal, and it makes the eardrum to vibrate. What you see here is the eardrum, and behind the eardrum, again inside the middle ear cavity, there are 3 small bones which help again, okay, to transmit the sound. They help not only to transmit, they amplify the sound energy, and they transmit the sound energy to the inner ear. The portion of the inner ear which is able to sense the sound is called as cochlea. This portion of the ear is very important, cochlea. Okay, sensory receptors irukku. In the sensory receptors and the sound energy maathidum. It will change it into electrical signals, and after the sound energy is changed into electrical signals, it will be transmitted via the nerves for hearing. This is the nerve for hearing, and the sound we hear in the right side, the sound we receive is heard in the left side of the brain. Similarly, the sound we hear on the left side is finally it is perceived on the right side of the brain. So it is very important. One more thing I will tell you. So you asked how the ear and the brain, how they are connected. So the inner ear, I told you, it is an organ for hearing. That is one thing. Besides this, the inner ear is also an organ for maintaining balance. This is the portion of the ear which is able to sense the hearing. As I told you, it is called cochlea. And this portion of the ear in the ring they are called as semicircular canals. In the kaadala 3 semicircular canal irukku, opposite earliyum 3 semicircular canal irukku. In the semicircular canals, they are able to sense the balance, which means the nerve which is able to carry the hearing information to the brain also carries the information for balance. If there is any problem either with the inner ear, அதாவது இன்னர் இயர்ல பிரச்சனை இருந்தா சரி, இல்லட்டா நர்வ்ல பிரச்சனை இருந்தாலும் சரி, இதுல பேலன்ஸ் இஷ்யூஸ் வரும், what we call as a vertigo. So, and it is very important, the vertigo can be due to a problem with the inner ear or could be a problem with the nerve. So that is why the ear and the brain are intricately connected.
இப்போ இருக்கிற அந்த ட்ரெண்ட், அந்த COVID-19 சிச்சுவேஷன்ல இப்போ நிறைய பேர் இந்த ஆன்லைன் கிளாஸஸ், ஆன்லைன் ஆஃபீஸ், அந்த மாதிரி நிறைய ஆன்லைன்ல நிறைய பண்றதுனால we are connected always through இந்த நெட்வொர்க்ல இயர்போன் போட்டு நிறைய கேட்டு போடுறோம். இதோட இம்பாக்ட் எவ்வளவு தூரம் நம்ம பாதிக்கும், நம்ம காதையோ நம்ம பிரெயினோ?
Right. So you want to know what is the long-term impact of using the headphones for the online education. இதில் not only for online education மட்டும் இல்லை, even for people who work from home, they also have to use the headphones. So definitely if you want me to answer the question, is a headphone harmful? My answer would be both a yes and a no. So I will tell you, the headphones are harmful if they are not used in the right way. But the headphones, if used in the right fashion, they are unlikely to cause harm. So I will tell you what is right and what is wrong. Adu onnu solren. So headphones it must not be used at a very loud volume. Neenga edha eduthalum you take a mobile phone or a tablet or a laptop, adla maximum volume la you try not to exceed 60% of the volume. Adu romba important. அப்புறம் ரெண்டாவது என்னன்னாக்கா I would say you can follow the rule of 60-60. 60% of the maximum volume. மேலே a person must not try to keep the volume levels more than 60% of the maximum volume. 60-60. The other 60 is that at end of every 60 minutes, which means 1 hour, okay, you can take a break from the system. So, this is important. So, this is repeated, if a person gets repeatedly exposed to loud noise, let us say about 80 decibels, 100 decibels, this may cause what is called as a noise-induced hearing loss, NIHL na solvom. As we discussed earlier, the inner ear, cochlea la irukra, the cells which are able to receive the signals, sound signals, adla hair cells na peru. அது ஹேர் செல்ஸ்னு பேர். இந்த ஹேர் செல்ஸ் என்ன ஆகுனாக்க அப் டு அ சர்டன் பாயிண்ட் தே கேன் டேக் ரிப்பீட்டட் நாய்ஸ். அந்த லெவலில் கூட if you are still able to lower the headset volume, whatever damage which has already happened to the cochlea and the hearing, and the damage வந்து we can reverse it. But beyond a certain stage, the damage which has happened to the cochlea and the hearing may not be reversible. It may not reverse. That's very important. So what I will tell is that do not use the headset for more than at a volume more than 60% of the maximum volume, and do not use it for any period more than 60 minutes. இப்போ வர சில ஹெட்ஃபோன்ஸில் இருக்கு, you have got the feature of the noise cancellation. Let me tell you about this. I do not know about the price of a noise cancellation phones. If they are affordable and if there is a need for online classes and online work from, you better go for a noise cancellation headphones. இதில் என்ன லாஜிக்னு நான் சொல்கிறேன்னா, ஸோ நீங்கள் ஹெட்ஃபோன்ஸ் நீங்கள் இப்போ யூஸ் பண்ணும்போது வெளியில் இருக்கிற ஆம்பியன்ட் நாய்ஸ்னு சொல்லுவாங்க. வெளியில் இருக்க இப்போ எல்லா வீட்லேயும் வந்து எவ்ரிபடி they cannot afford to stay in a totally soundproof room. அதனால் ambient noise இருக்கும். அந்த ambient noise நம்ம அதையும் வந்து ஓவர்கம் பண்ணி we have to go for either online education or work from home, which means that we have to increase the volume of the headset. Whereas in the noise cancellation headsets, அது என்ன பெரிய biggest advantage is that they are able to filter the ambient noise. அந்த வெளியில் வர சத்தம் வராது. So that we can keep this headset volume at the lowest level possible. So to put the whole thing in a brief, in a nutshell, நான் என்ன சொல்றேன்னாக்க headset volume keep it at the level in which it is audible, not even 1% more than what is required. And on the இன்னொன்று என்னன்னாக்க, ஓகே சரி, இப்போ இருக்க செனாரியோவில் use of headsets for other purposes, entertainment, music and all, especially those who have to use the headset for long periods for work or education, use of headset for entertainment, for music, for watching movies, it may better be avoided. Okay, this is what I would tell. So headset harmful na? Yes, it is harmful when used in the wrong way, but it is okay if you use it in the right way, because today, because of the pandemic situation, it is the need of the hour. One more point I would like to tell, between the two type of headsets, there are some headsets where you insert it's like a ear plug into the canal, and the other type of headsets where you fit it as a cup. So idhula enna solana, the cup type of headsets are better than the insert type of headsets. இதுக்கு என்ன ரீசன்னு நான் சொல்கிறேன்னா, கப் டைப் ஆஃப் ஹெட்செட்டில் பை த டைம் த சவுண்ட் ரீச்சஸ் ஃப்ரம் த கப் டு த இயர்ட்ரம், த சவுண்ட் லெவல் வில் கம் டவுன். இட் வில் பி பஃபர் ஆகிடும் கொஞ்சம். இன்சர்ட் டைப் ஆஃப் ஹெட்செட்ஸில் வாட் எவர் சவுண்ட் இஸ் ஸ்ப்ரெட் த்ரூ த ஹெட்செட், இட் வில் நாட் பி டேம்பன்ட் ஆர் பஃபர்டு. ஸோ நீங்கள் 60 decibels அமிச்சா அது 60 decibels போய் சேரும். வேரஸ் இந்த டைப் ஆஃப் ஹெட்செட்ஸ், கப் டைப் ஹெட்செட்ஸில் if the headset receives a 60 decibel sound, partly it will be buffered, maybe about 45 to 50 decibels. So I would say using a cup type headset is better.
Since we are always connected online for be it for office purposes or for school children, they are essentially needed to talk, whether it is an employee or a student. In the way the teacher-student communication and the constant throat
Right. Again, it's a very interesting question. The answer would be on the same lines as for hearing. It depends upon how much we use the throat, how much the voice is used properly, and how much it is abused. In fact, from the point of view of online education, it's an occupational hazard more for the teachers than for students, because the teacher is going to address non-stop, for a few hours, whereas the same will not be the situation for the student, who is at maximum going to answer 1 or 2 questions. And likewise, working from home, that also poses a lot of strain on the vocal cords. As we said earlier, how we give a break when we use the headsets. Frequently, we must also give a break to give the voice the much needed rest. That's very important. And everybody must also learn to cultivate something called as a voice hygiene, or also called vocal hygiene. In a vocal hygiene, simple measures I will tell you, which will go a long way. But good hydration is very important. Hydration, not to what extent, I will tell you, it is like this. Much like an engine of a car requires oil as a lubrication, the vocal cords, it requires lot of water, and this water comes from basically the water we drink, to what level we are hydrated. So 2 to 2.5 liters of water per day intake is very important. So that's one. So vocal hygiene, first point is to keep up good hydration. Second is the point to be stressed in vocal hygiene. Throat, frequently it must not be cleared. So they are often in the habit of getting the throat cleared. They think they have some mucus, so this is going to pose additional stress on the vocal cords. You have to avoid some habits, like for already the vocal cord is under strain due to excessive use of voice, and we must not add injury to the insult to injury. Rather, habits like cigarette smoking must be avoided at all cost. Either one. I will also put a brief point about the diet which we have to take to maintain a good hygiene. And basically the diet that we take must be bland. Spicy foods must be avoided at all cost. So, and also just as you can take a break by avoiding excessive use of headphones, you also try to take a break at the end of every 1 hour. Online classes, what the teachers can do, rotation of classes. That will be more helpful.
Impact of COVID in the long run. Variants impact in the long run.
We are all talking about a subject which is very, very new. The COVID as a pandemic was declared in the first quarter of 2020. So it is now hardly 2 years since we know COVID as a pandemic. So little is known about the long-term impact of COVID on the ENT organs. But yet I will tell you how this infection, COVID-19, caused by the SARS-CoV-2 virus, what are the impact on some of the ENT areas. So basically it is like this. The virus, like any other virus, like influenza virus or the virus which generally cause common cold, the route of entry is basically through the nasal passages. Initially, all the symptoms will be that of an upper respiratory infection, like a nose block, symptoms of a cold or a sore throat. And sometimes we find, but luckily not in this variant. Now when we had the Delta variant, Many people had complained of loss of smell and also loss of taste. They had complained during the Delta variant, which was at its peak in April and May of 2021. With the Omicron variant, we don't see that many patients reporting with loss of smell and loss of taste. Luckily, even with the Delta variant, most of them who had loss of smell and loss of taste, within a matter of few months, they fully recovered both the sense of smell and the taste. And in our practice, I have not come across any patient who says, I have lost my sense of smell for more than 3 months. That is one thing. And about in a long term, of course, during the Delta variant, we also had this the so-called black fungus which used to affect the sinuses. அதுக்கு வந்து mucormycosis அப்படின்னு பேரு. And mucormycosis, again, luckily, in the variantல, in the Omicron variantல, at least in my practice, I have not seen even a single instance of a mucormycosis. But in the earlier variant, the Delta variant, the mucormycosis was very, very rampant. That disease was a very aggressive disease, and most of the patients on the mucormycosis COVID uncontrolled diabetics. Apart from that, regarding the long-term effects of COVID on ENT organs, results are yet to come. But there have been some reports of patients undergoing loss of hearing loss. Adu irundirukku reports. But still, many of the reports are not fully published. Some of them reporting hearing loss, some of them developing also vertigo. In the Marlamu complaints. But yet, I think we'll have to wait and see. Generally, I don't think the long-term effects of COVID are much upon the ENT organs.
Are there any home remedies for any of the ear, nose, throat?
Well, you have asked me about what are the home remedies, common home remedies for ENT. Home remedies means, I think, with whatever is available at our home. And I would not equate this home remedies by using only native medicines. Native medicines தான் யூஸ் பண்ணணும் இல்லை. You can use also allopathic medicines as a home remedy. So, in the home remedies for ENT problemத்துக்கு ரெண்டு common conditions in ENT நான் சொல்கிறேன். Because for want of time, we cannot be very exhaustive. So, one complaint which we see very commonly is acute onset of ear pain. இது ஒன்று உண்டு. So, as I told you, the ear pain it can be due to innumerable causes. But let me tell you what all can cause a ear pain. Okay, the ear pain it could originate from a problem in the ear canal itself. Okay, the ear canal may be filled up with very hard wax, and this may itself may result in ear pain. In the hard wax, to dissolve it, there are numerous drops available, and they are all over-the-counter medications. இதை எடுத்துக்கலாம் நீங்கள். இதை எடுத்துட்டு ஒரு 3-4 நாள் போடலாம், and discomfort and pain definitely with the use of drops it will reduce. அது ஒன்று. And secondly, என்னன்னாக்கா external ear canal again can harbor some fungus infection. Fungus. அதனால் even due to fungus there may be some ear pain. It can result. So, இப்போ ஃபங்கஸ்க்கு என்ன பண்ணலான்னா அதுக்கு நேட்டிவ் மெடிசன்ஸ் இட் கேன் பி யூஸ்டு. இந்த இதில் பூண்டு இருக்கோ இல்லையோ, கார்லிக் ஆயில், இட் இஸ் நோன் டு பி எஃபெக்டிவ். அது என்னன்னாக்கா, த கார்லிக் ஆயில் is supposed to possess antibacterial, and it's supposed to possess also in the antifungal properties, and garlic oil can also reduce the inflammation and pain. Adu use pannalam. So, as I told you, if the patient feels that this pain is due to wax, or if he has had a history of wax in the past, he can very well assume the pain is due to wax and put appropriate drops. And or if the patient, he or she feels that she has already had lots of fungal infections in the past, she can use this medicine, oil made out of garlic. அதை பண்ணலாம். Sometimes வந்து infection may occur beyond the eardrum. Okay, சரியா, middle ear infection. In the middle ear infection is called as otitis media. Otitis media na middle ear infection. As I told you earlier in my talk, first get is there any connection between the ear, nose and the throat? Otitis media common எதனால வருதுனாக்க due to cold. Upper respiratory tract infection இருந்தனாக்க that may clog the passage between the middle ear and the nose. So அதனா otitis media the pain can be very very intense. So இதுக்கு என்ன பண்ணலாம்னாக்க they can get the symptoms of cold relieved by using some nasal drops to minimize the nasal congestion. The nasal congestion, they can take some simple medication for pain. Paracetamol can be taken. Now you can get paracetamol off the counter, okay, without the doctor's prescription you can get. And few other things can be done as home remedies. You can apply okay, warm compressions over the ear which will give relief for pain. Adhe mari you can also apply some ice packs, either okay, warmth or cold you can apply. And you can also ask the person to lie down with the head slightly up. Thalaiya mela thookin padthunaka that will reduce the inflammation and the congestion in the ear. But as I said, in the drops lam podrom wax ku that may get the pain relieved, but still the ear will be blocked. So ideally it is better to go and see the doctor, get the opinion and get the ears clean. Likewise, ear pain on the home remedies try panni 2-3 days மேல இருந்ததுனாக்க கூட it is better wiser decision to go and see the doctor and do the needful.
Doctor, you have already given me the answer to this question, but still I'm stressing this point because children of it are connected to the online classes, music classes அப்படி நிறைய போறாங்க. இவங்க வளர இன்ஃபேக்ட் அந்த குழந்தைங்களோட ஃபியூச்சர்ல அந்த ஹியரிங்கோ அந்த த்ரோட் ப்ராப்ளமோ இன்னும் கொஞ்சம் ஜாஸ்தியாகாது. 20 வயசுல நம்மளுக்கு வந்து பெருசா வராது.
Right. You see, right now due to the pandemic situation, we are living in a world of new norms. But I am sure that we are slowly going to see the end of the pandemic. This is my guess, and I hope that I am correct. And you had asked me the question, say about the repeated use of headphones for children, the need to attend the online classes, and also not only the education in school, but they go for various other classes outside of school, like attend music classes, which are also done online. As I said earlier, my answer would be the same, is to limit the use of the headset. And also, as I said earlier, the optimal use of the headset is also very, very important. I would also like to add here, we are with the online education, we are talking not only about ENT issues alone, but there are lots of other issues. Like for example, sitting in the monitor for a long time, and unfortunately many people, children from the lower socioeconomic group, they don't have access to a tablet or a laptop, and they have to really put their eyes to strain and attend the whole class, online class, by using a mobile phone where the screen is so small. So idanala this puts lot of strain upon the eye, upon the visual apparatus, and it causes eye strain and also headache it causes. And I am seeing what I have noticed in the recent past as an ENT practitioner. We are seeing children getting vertigo very, very often. And often if it's a problem of the vertigo problem, the patients they go and consult either the neurology doctor, or apart from the neurology they also see the ENT, because nowadays people are very well aware that vertigo is caused by ear problems. And idhula vanda what I have seen in the recent past, many children developing vertigo issues and accompanied by headache. So all these children developing headache and vertigo problem என்னன்னாக்கா it is all triggered by migraine. இதில் வந்து migraine-க்கு one of the triggers is that if you spend long time in front of the screen, இந்த screen timeங்கிறது ஒன்று இருக்கு, ஒரு it must generally not exceed 4 to 6 hours a day. ஆனால் இப்போ இருக்கிற ஆன்லைன் education formatல we have to spend much longer time with the screen. ஓகே, அதாவது என்னன்னாக்கா இந்த ஸ்க்ரீன் டைம் என்ன சொல்கிறேன்னாக்கா it includes everything. Use of mobile phone, use of laptop or computer, and even okay, watching television. So you had asked a question in which you had addressed the long-term effects of this online education for children. Not only online education but various online tuition classes. In the online tuition classes, music, other tuitions. Apart from the academics, they go mathematics tuition, IIT coaching class. In the Mari, okay, lots of classes they are going for. So, இதில் வந்து என்னோட பதில் என்ன இருக்குன்னாக்கா லாஸ்ட் டைம் சொன்ன அதே பதில் தான், ஆப்டிமல் யூஸ் ஆஃப் த ஹெட்ஃபோன்ஸ். இதுதான் as I said in the earlier இது question, it's a rule of 60-60. 60% of maximum volume and rough usage of cell phone must not exceed more than 60 minutes a stretch. After 60 minutes, you have to give it a break. So, இது important. Optimal use. இதை தவிர, let me talk briefly about the impact of the online education upon the other systems of the body. So, repeatedly sitting in front of the monitor, and unfortunately many children, they cannot afford to even buy a laptop computer. So, அதனால் என்ன பண்ணுறான், இந்த மொபைல் ஃபோனுக்குள்ளேயே they attend the online classes right through the entire day. And this puts lot of strain upon the visual apparatus, leading to eye strain and headache. And off late I have noticed during the past about since the onset of pandemic, lot of children feeling dizzy and developing symptoms of vertigo. And most often we find they are suffering from migraine. And we all know that people who have migraine, it is often triggered by the moving images that they see on the monitor or by getting exposed to loud noise. So, okay, this is also a thing which we are seeing with increased frequency during this online format. And இதை தவிர வேற என்ன பார்க்குறேன்னாக்கா, children வந்து they are not able to interact with other children, with their peers. They go for anxiety, they go for depression. இதுவும் இருக்கு. ரெண்டாவது, and they spend inadequate time outdoors. So lack of sunlight, the vitamin D deficiency, they develop aches and pains in the bone and joints. இந்த மாதிரிலாம் okay, lots of things are happening today. But என்னன்னாக்கா at the end of the day, I would say, luckily we are seeing the end of the pandemic with the decreasing number of cases today, and compared to the Delta variant, this new variant of SARS-CoV-2, Omicron, is definitely less lethal. So I think with all this, I think we are looking at the future which is a little bright. So far what was a big pandemic is eventually going to end as an endemic. So I think we are seeing the end game slowly in future. Let us hope for the best.